In our course, we will be using SBAR plus R as faculty members to help you decide what information is best to communicate to a physician in an emergent or patient concern scenario. We will be doing this in response to case studies that you will complete in the course. It's important to know how best to contact the person who needs critical information about your patient. The method of communication is rapidly changing from phone or paging to text messages or messaging apps. Use of the HIPAA-approved modalities according to both your facility and physician preference, if known, is very important. Before assuming that a physician you are attempting to reach is not responding, use all these modalities. For emergent situations, use the appropriate resident or hospitalist as needed to ensure safe patient care. Before calling or contacting a physician, follow these steps. Have you seen and assessed the patient yourself before calling? Has the situation been discussed with a resource RN or preceptor? Review the chart for the appropriate physician to call. Sometimes you're calling someone who is not the correct contact. Know the admitting diagnosis and date of admission. Have you read the most recent physician progress notes? Any notes from the RN left from the shift before you? In addition, you should have available the following when speaking or texting with the physician. Notice that this information is things that you should have available, but are not necessarily shared in the course of an SBAR communication. You should have the patient's chart, current medicines, allergies, IV fluids, labs, the most recent vital signs, and when reporting lab results, be sure to report the date and time these were done, as that is critical to the interpretation of the lab work, as well as being aware of the person's code status. The SBAR plus R format, which stands for situation, background, assessment, request, and repeat back. This technique provides a framework for communication between members of the healthcare team about a person's condition. And it was first developed in the military, but many hospitals and healthcare organizations have adopted this mechanism. It's especially helpful when communicating critical information. And so in the course, as you read cases, be thinking about what would be a critical incident. Sometimes you have to use your imagination and imagine the worst case scenario, because not all the cases that you will be doing this assignment with appear critical. So be aware that you will need, for this to work best, you need to think about something that could go wrong with that patient in your case. So when you need that immediate attention, use SBAR to allow for easy, focused way to set expectations for what will be communicated and how between team members. So this is so important for a culture of patient safety. We'll be using this format to apply components of assessment to the communication of critical information in a phone call or a text for 3 assignments in our course. So when calling a physician, follow this process. Situation. What is the situation you are calling about? For our assignments, you need to identify yourself by full name and credential. That's you are an RN, that you get points for identifying yourself as an RN, not the generic term nurse. The patient name and room number. Sometimes it's helpful to indicate your experience. I've been an RN for 10 years, but this is my first time working with this type of patient, or I've worked with this type of problem for decades, or I am a brand new RN. So sometimes identifying your experience is helpful also in helping the person who are listening understand why you might be asking the question or communicating the concern you have. Then you need to briefly state the problem. What is your concern or reason for a call? I'm calling because of deteriorating vital signs, and I'm concerned that my patient has, for example, internal bleeding. So stating the reason you call right up front is important because it helps to frame all the other information that you are providing. In addition, in our course, you're going to learn how to write a history of present illness using either a PQRSTU or old cards. Both of these are mnemonics that talk about if a problem, what makes a problem better or worse, when it started, its severity, the person's understanding of it, characteristics of the problem, does it radiate, or are there concomitant symptoms? So that is what needs to be stated in your situation as well. So you will say something like, the vital signs started deteriorating 2 hours ago. That's your T, or your timing of this. Providing the vital sign itself would be a characteristic or a quality, Q or C, depending which mnemonic you're using. And then additional symptoms like also being pale or being confused or being clammy. Those would be related symptoms or an idea of relating. And then what if you tried to fix the problem? I've applied oxygen, I've elevated the foot of bed, anything that you've done, and the response of the patient to the things that you've done would be the palliative or provoking. Like maybe the problem only happens when the person stands up. Is it when they change positions, or is it or what else brings on the symptom? So that should be provided in your situation for the SBAR and for complete credit for these assignments. B, background. This is where we really get to see your critical thinking, because you need to provide just the pertinent background information that's related to the situation. This could be pertinent medical or surgical history, additional assessment data pertinent to the concern, and it could include the most recent vital signs, but it doesn't always, depending on the problem you're calling about. For example, someone who has a skin rash, that might not involve any vital signs in reporting it. You might include the admitting diagnosis, but not always. That may be provided above in the situation. List of current medications. Well, people, as you know, often have 20 medications. You should not report all of those in your call, but you should consider which medications are important to the situation you're calling about. Allergies should be included if you're going to be asking for a prescription or additional medication. If you're not, you don't need to include the medication allergies. IV fluids may be important or may not, as well as labs. So as I said before, be sure to provide the date and time of lab tests, as that presents those labs in an important context. So this should not read like a nursing report, like the person is alert and oriented. That may be important for the reason you're calling, but it may not be. So you should not think of this as your nursing report. You should think of it as selecting the critical elements that lead you to your A. And the A in this situation is not assessment the way you and I think about it. It's your assessment of the overall situation. So it's better to think of this A as a conclusion. A conclusion is restating the concern or problem. Although labeled assessment, just remember, it's not the assessment information that is in the S and the B, but this is your conclusion about the problem. So in the example I was providing, the conclusion is, I'm concerned that this person might be having internal bleeding or might be having an MI. So this is your assessment of what the core problem that you're calling about is. finally, we get to the R. This is the request. What is your request as the RN? What do you believe the patient needs? So you're not just calling to give someone a report about the patient, although I guess that could happen. That's rarely emergent. But instead, it's, I believe this patient needs your assessment now. I'm requesting new orders for, and you may ask for certain things. So, or it can even be a statement of just, whatever is within your scope of practice to ask about. You shouldn't not really, most of us should not be making recommendations to the physician, but we can certainly make requests. And so unless you're asked, like, well, what do you think would be best? Just remember a request may be the best way to operate. So finally, there's the plus R. This is the repeat back. What did the RN hear the physician say? For example, so I heard you say you'll come back and see the patient now. I heard you say you want me to place an order for X, Y, and Z. And if it's a drug order, it should include all the 5 rights. You want me to start an IV. So this is repeating back what you heard, and it's important to close the loop of communication. It also gives the person who responded to your request an opportunity to think a little longer about if anything else is needed. So rather than just like, okay, I heard that and boom, you're done. This gives the person an opportunity to maybe add something that they need. So that's why that is also important. So in this way, the SBAR is an important opportunity to communicate well in all kinds of emergent situations. Thanks for listening.